My name is Marissa Wilson. Here is my student ID. You can see that. Next, I'm going to do a 360 of the room. Okay, and sit back up. Hi, my name is Marissa Wilson, and I'm going to be conducting a cardiac exam on you today.
Okay.
Okay, first, I'm going to have you tilt your head that way, and then tilt your head the other way. Okay, jugular venous pressure is flat and non-distended, and then point of maximal impulse. There are no abnormal or visible pulsations. Next, I'm just going to feel your carotids. Okay, carotids are 2+ bilaterally. Next, I'm just going to feel for the angle of Louis, which is where the mandibula meets the sternal body, right here. Then I'm going to walk along to the right, on the right side to the second intercostal space. This is the apical. And then from the angle of Louis, I'm going to walk down on the left side to the second intercostal space. This is the tricuspid. On the left side, I'm going to keep going to the fourth or fifth intercostal space, even with the xiphoid. This is the pulmonic. And then from the fourth or fifth intercostal space over to the midclavicular line is the mitral. Also, it can be the point of maximal impulse, which is a gentle tapping. Next, I'm just going to take a listen to you. I'm going to listen to your carotids first with the bell of my stethoscope, and I'll have you hold your breath when I do it. Okay, hold your breath. Okay, you can breathe. And we'll do the other side. Hold your breath. Okay, no carotid bruits heard. Next, I'm going to listen to those same 4 points with my stethoscope, okay? First, I'll start with the diaphragm. You can breathe normal. I'm going to listen again and switch it over to the bell of my stethoscope. Regular rate and rhythm, no S3, S4, clicks, or gallops heard. Next, I'm going to have you lay a little bit on your left side, and I'm going to listen to that mitral sound again, okay? I'm going to listen with the diaphragm of my stethoscope. Okay, lay back. No S3, S4, murmurs, or mitral stenosis heard. Next, I'm going to have you sit up just a little bit. Adjust this cane. And then I'm going to have you lean forward, and I'm going to listen to the aortic. Can you move that arm? With the diaphragm of my stethoscope. I'm going to have you exhale out, okay? No aortic stenosis heard. You can go ahead and sit back. Next, I'm just going to take a look at your arms. I'm going to flip them. Okay. Arms are equal and symmetric bilaterally. They're warm to the touch. No rashes or lesions present, and there's even hair distribution throughout. I'm going to just take a look at the color of your nail beds. No cyanosis noted in the arms or in the nail beds. And then again, I'm going to flip you. And then there's even and normal distribution of his veins. Okay, next I'm just going to feel some pulses. So I'm going to feel your radial pulses first, which are 2+ bilaterally. Then I'm going to feel your brachial pulses, which are 2+ bilaterally. And then I'm going to feel what's called your epitrochlear nodes, which are soft, small, does this hurt at all? And non-tender. I'm going to flip you over again, and I'm going to just check the capillary refill of your nails. Capillary refill bilaterally is less than 2 seconds. Next, I'm just going to take a look at your legs. Can you uncross them for me, please? Okay. Legs are equal and symmetric bilaterally. There are some scars noted throughout. Legs are warm to the touch, even hair distribution. And then I'm going to look at your toes again. No cyanosis noted in the legs or in the toes. Just going to feel for some edema in some places. Back here. And then no pitting edema seen. Next, I'm just going to feel some pulses, okay? First, I'm going to start with your dorsalis pedis pulses, which are 2+ bilaterally. Then your posterior tibialis pulses, which are 2+ bilaterally. Next, I'm going to have you bend your knees just a little bit. And feel your popliteal pulses, which are 2+ bilaterally. Okay, I'm going to feel your femoral pulses. All right. Which are 2+ bilaterally, and then I'm going to feel your inguinal nodes, which are small, soft. Does this hurt? No. And non-tender. Okay. Next, I'm just going to look at the capillary refill of your toes as well. Okay, and the capillary refill of your toes is 2+. And then I'm going to have you stand real quickly just so I can look for some varicose veins in your legs. Okay, and I'm going to have you turn. Okay, no varicose veins noted. You can sit back down. Next, I'm going to do what's called an Allen's test, where I'm going to occlude the 2 veins in your arm and then release one at a time to see the blood flow to your hand, okay? So can you go ahead and make a fist for me? And open. Okay, make a fist. And open. Okay, and we'll do the same thing on this side. Make a fist. And open. Make a fist. And open. Okay. Normal blood flow bilaterally. We're going to do the same thing kind of to your feet, where I'm going to have you raise your legs up for about a minute. And then we'll have you stand up to see the timing of the blood flow to your feet. Okay?
Okay.
I can help you with your legs. Let's go ahead and lift them. We'll wait till your feet turn a little pale. Okay, and then I'll go ahead and have you scoot to the edge here and stand up. Okay. It took about 15 seconds for the blood flow to get back to your feet, which is normal.
Okay.
All right, that concludes our cardiac assessment.